Welcome, and thank you for joining us here on the NPTE Final Frontier podcast. My name is Dr. David Friedberg.
And my name is Dr. Emily Gerby. Today, we are focusing on our gait deviation series, and this is part 3 of our 30-part series. So this is the final portion. All right, over to you, David.
And since this is the final part of that portion, you know what's about to happen. You're going to get a question. So here is the question. A patient demonstrates premature heel-off during mid-stance on the right lower extremity, resulting in a shortened contralateral step length. Which of the following is the most likely underlying impairment? Is it option A, right soleus tightness? Option B, right gastrocnemius tightness? Option C, right dorsiflexor weakness? Or is it option D, right plantar flexor weakness?
All right, let's break down this question. Remember, what are those key findings? What are you highlighting? Well, for this question, we notice that our patient is demonstrating premature heel-off during mid-stance and shortened contralateral step length. So those are the things we should be highlighting for this question. Now remember, during mid-stance, the tibia needs to translate forward over the foot. In order for our tibia to translate forward, this requires adequate ankle dorsiflexion. If our dorsiflexion is limited, the body is going to be compensated by lifting the heel early, also referred to as premature heel off. Now the question becomes, what is limiting dorsiflexion? Because if we don't have adequate dorsiflexion, this is what is leading to that premature heel off. Now, if the restriction is present during mid-stance, when the knee is flexing, the primary limiting structure is the soleus because it crosses only the ankle joint. Now, let's go through the answer choices. Option A, right soleus tightness. Right off the bat, this looks like a great option choice. And it is, in fact, the correct option choice, right soleus tightness. Because our soleus tightness, again, limits dorsiflexion when the knee is flexed, leading to premature heel-off in mid-stance. Now, why would option B, right gastrocnemius tightness, be incorrect? Because that's also one of our calf muscles, right? Well, this is incorrect because the gastrocnemius, remember, is a two-joint muscle. It crosses both the knee and the ankle. Its restriction is most evident when the knee is extended, such as terminal stance, not primarily mid-stance. So we can cross off option B. Next up, option C, our right dorsiflexion weakness. Well, this is incorrect because dorsiflexion weakness would present more as a foot slap during loading response or toe drag during swing, not so much premature heel off. It's not so much apparent during our closed chain or our stance phase movement. And then option D, our right plantar flexor weakness. This is also incorrect because our plantar flexor weakness would impair more push-off in terminal stance, not so much what we're seeing here with this question stem. It would not cause an early heel rise. So again, option A, our right soleus tightness, would be the best option choice for this question.
And now this is a great example of how the NPTE integrates timing, joint mechanics, and anatomy into one question. You have to identify the phase, which is mid-stance, and then you have to ask what motion is required. The tibia, well, it must progress forward, which requires dorsiflexion, correct. If that motion is blocked, the patient compensates by coming up onto the toes early.
So here's the key distinction that really makes this question a little bit higher level, right? There's a few different layers to this question. Let's think of this question like an onion, right? That is a nice little Shrek reference. So there are a few different layers to this question. Understanding first the difference between the gastrocnemius and the soleus. So again, if this question described limitations when the knee was extended, you would have think gastroc because it's a two joint muscle. If it was more with the knee being flexed, like this question, we're thinking more of the soleus because that's only a one joint muscle. So that's the first thing to look at. The other important piece, remember, this question also mentioned contralateral step length. If the stance limb cannot progress forward, that means the opposite limb cannot take a full step, which would shorten the stride length. So when you see premature heel off, always think limited dorsiflexion, and then use the phase of gait to determine whether it's more of a soleus or a gastrocnemius involvement. That level of reasoning is exactly what separates a correct answer from an answer that's a little bit more of a guess on the NPTE. So I hope you found that helpful.
Now that you heard this episode of the podcast, here is a quote from Henry Ford. Failure is simply the opportunity to begin again. This time, more intelligently. Guess what? Each time that you fail or you do something incorrectly, it is a moment where you get to improve. You get to learn. Where did you go wrong? So this way, in the future, you can go right. And that's with anything in life, right? Not just this exam, but in life in general. So keep on being proud of the mistakes that you make and keep on making mistakes, but learn from them, learn from them, learn from them, and then progress forward. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on Final Frontier, please visit npteff.com. You can also check out all of those social media platforms such as Facebook, Instagram, TikTok, and X.
Till next time, have a great day and a powerful tomorrow.